All right. I apologize for that technical glitch, but Facebook Live is a little new to us, so please pardon us. So again, Colonel Smith and Colonel Meador for your weekly Redstone Arsenal Town Hall. Typically we do this we've done this at Redstone's Garrison Conference Center. Today we're doing it at Fox Army Health Center. I apologize for the bait and switch, but a number of you have asked us a considerable number of questions for Fox Army Health Center. So we've consolidated those questions and asked our health professionals to sit in with us today and answer those for you. What we'll do is we've taken your questions over the course of the week and we've kind of consolidated them down into, for me, 5 initial questions, and for Colonel Meador, 5 initial questions for Fox. And we'll attempt to answer those questions as we initially engage with you. And then as you post them, our teams will consolidate them and answer them back. I apologize if we don't get to your very specific question, but we'll try to generalize it to accommodate 3 to 4 other questions at a time. So my first question this morning is, what is Redstone Arsenal doing to help prevent the spread of COVID-19? And for those of you that have been watching these and paying attention to our previous engagements, there's a number of things we've done. But what I'd like to first talk about is a meeting Colonel Meador and I had yesterday evening. We met with General Perna, the AMC CG, and the senior ranking commander here on Redstone, as well as our senior commander, Lieutenant General Edward Daly. We met last night to discuss the precautions that we've already put in place and how those precautions are synchronized with the local community in the state. And I'm here to tell you that I think Redstone Arsenal to date is in the lead. We're leading in regards to the precautions that we've taken here on the Arsenal that enable you to remain safe, secure, and feel protected from the virus. First and foremost, though, based on all the precautions that we've put in place, those precautions are to limit the number of folks that are required to come to work here, to limit the social interactions that occur while we're here, and to limit those spaces where large gatherings could occur. But the first and foremost thing that needs to happen is that each and every one of us needs to abide by those precautions and to take our own personal precautions, whether they are our preventive medicine or hygiene, our personal hygiene, keeping our hands clean, coughing into or sneezing into our elbow, and certainly accommodating the space in between each and every one of us throughout the day. And then, of course, disciplining ourselves and our families to go to work and return home, but to limit the number of interactions, physical interactions, that we have with one another in our each and everyday lives. That is the best way that each one of us can help to protect ourselves and in turn protect the workforce that works here on the Arsenal and conducts those mission essential tasks. I think that generally discusses what we've done. I'll go into a few specifics. As you know, we've significantly reduced the workforce here. All of the senior tenants here and the commanders have enacted maximum telework policies. And so today, Redstone Arsenal, rather than being 44,000 people at work on the Arsenal, we're only around 16,000 people on the Arsenal. We've reduced to less than 25%. In turn, we've taken all of our dining facilities that everyone relies on each and every day, and we've reduced those to takeout only. We've reduced all of the Cat A and Cat C, or the entertainment programs, such as outdoor rec, bingo, bowling. All of those have been suspended for the time being in order to limit the amount of interactions. And then in turn, we have consolidated the CDCs. So as the demand has diminished, we've reduced our child development center from 2 child development centers down to 1. And we've done the same thing with our school age center. We believe that has allowed us to put quite a few of our employees, allow our employees to go home and telework. and to put those folks in reserve for a later date so that as some of us go into quarantine, we have others to call upon to continue the mission essential services. Those are all efforts that to date Redstone Arsenal has put in place to limit the number of people as well as to combat COVID-19. That answers my first question for the day. And so what I'm going to do is I'm going to pass it over to Colonel Buddy Meador, my current battle buddy, and Fox Army Health Center to answer some of your more professionally based healthcare questions.
Yeah, thank you, Kelsey. Good morning, Team Redstone and families. Thanks for joining us today. It's always a pleasure to address you and answer questions as you've seen them in these current times. Again, thank you for your time. And it's great to see you out there as you begin to join in or are joining in. And I can see a few familiar faces up there on our Facebook member box there. So again, thank you for joining us. I have the pleasure today to introduce two of my subject matter experts here at Fox. To my immediate left is Dr. Mike Madkins. Colonel Madkins serves as our Patient Center Medical Home Director. For our enrolled members here at Fox, if you come into either red, white, or blue teams, Dr. Madkins is the director for all those teams. And so if you understand where we are in our chain of command, that's where he resides and maintains all of our primary care here at Fox Army Health Center. Over to my far right, you can see Miss Suzette Baker. Ms. Baker serves as the Fox Army Health Center Pharmacy Chief. She's been here for a number of years and remains our pharmacy subject matter expert, and I know you'll look forward to hearing from her in just a second. I want to take the opportunity to provide just a couple of updates and answer a couple of questions that we've already received in this morning. For those of you who've been to Fox here of late, you've seen a number of changes that I'll go over in case you haven't been here. But as you know now, every person who comes into Fox Army Health Center is screened. And that goes for employees as well. For our patients arriving, before you come to the facility, you've noticed or will notice that we have these large yellow tents up in front of the pharmacy entrance. Please build a little bit of time into your schedule if you're coming inside, whether it be an appointment or if you have a new prescription. We ask that you please understand that there's an extra precaution to continue to protect the staff and you. We just need to ask a few questions of you. We're going to take your temperature very quickly and then get you expeditiously into the facility. Just in case you do screen positive, which means based on how you answer the questions or if we see something about your temperature that maybe you want to talk to you a little bit about, we're still going to get you your treatment and or your medications for whatever reason that you came into Fox. We're going to ensure that that treatment or our meds gets processed into you. Just know that we're going to take you to an outside portion of our facility, again, as a precaution to ensure we keep the facility clean and protect staff and patients alike. Which is also a good point to bring up too about outside operations. You'll notice too now we have a drive-through pharmacy for all your refills, which Ms. Baker will go into detail here in just a minute. Again, just another plug-in that you add a little more time into your schedule. We are not able at this point to predict surge. Sometimes the lines are a bit long outside there for cars coming up. I can tell you we've expanded our ability to go up to 6 lanes, which helps with getting cars more quickly through. But we continue to enact the Chick-fil-A method where we interview patients in cars a little bit further back depending on where the line is. But please know we continue to refine our process to get you through as quickly as possible. But appreciate your understanding and patience. As I've seen you in the cars and spoken with some of you, you all are very appreciative not only of the service, but I appreciate your patience and understanding as we all are now or get accompanied to this new norm. I'd like to answer another question here about personal identifiable information as it relates to HIPAA, especially in a scenario where maybe a staff member or a coworker was identified as COVID positive. And I want to make sure that example is something that we use for a tenant organization here on the Arsenal. Here at Fox, we have the responsibility to provide our senior leaders on Redstone Arsenal with a health situational template, so to speak, of the Arsenal. And with that, we maintain a running tally or a running sheet, if you will, of those who are in quarantine or being monitored, and as well those who may have presented themselves or since tested positive for COVID-19. What I will tell you is I have 3 registered nurses who are the heartbeat of our monitoring and COVID-19 information cell. And I say that because your information is held with one of those 3 individuals and absolutely not transmitted to anyone but our senior leader, in so much as numbers are concerned, so that our senior leaders have a good idea of where the arsenal is in health, and merely that. My 3 wonderful employees in that cell are Miss Melanie Linehan, Miss Allison Fuller, and Major Keisha Williams. And I state their names so that if you see an email from them, please don't hesitate to respond back. They're also there to help answer your questions about any concerns you might have. And they're also the ones who, if we test you here at Fox, are going to be talking back with you about results and what that means for you, even if you're not enrolled to us. Which takes me into the next point I'd like to bring up, and that's about testing. We've had a lot of questions about testing. I'm happy to report that while we have had a previous contract with testing, we've since moved on to a new avenue now, which has allowed for us a more expedient return time and results. It's been helping us out immensely. I do want to caveat all that with the fact that testing resources are still finite. And by that, we still have to monitor and mitigate, or I guess be somewhat of a gatekeeper on who gets tested. In the scenario that we just described about someone in your organization who maybe has presented or come up as COVID positive, you will more likely be contacted by your chain of command or one of us here at Fox. If you were in sustained or direct contact with that individual, we will invite you over here to Fox to test you and bring that result back to you. And that's so that we can maintain the pulse and some control and prevention here on Fox, I say Fox, Redstone Arsenal, so that we, as best we can, prevent the spread. And we do that by way of knowledge, information. So if you were in close contact with a fellow staff member who has since tested positive, we want to invite you, and we will reach out to you by name, bring you over, test you, give you results so that you have the knowledge and information on how to proceed not only in your daily personal life, but your daily work life too. Again, that's how we maintain that health situational template for Redstone Arsenal. But that was a great question we had there just a minute. Excuse me. Last question I'll discuss before I hand it over to Ms. Baker from our pharmacy is what will be Fox Army Health Center status if the state goes to a shelter in place? Fox Army Health Center will continue to treat as a medical facility. We will not close. We are here to support our population, and in that regard, we remain open. In any situation where the state, if whatever reason the governor decides to impose a shelter in place, Fox Army Health Center remains open to support you in the manner that we do today. Now, some decisions maybe have to be executed on my behalf, along with what Colonel Smith and the Garrison will do about some of the services we provide, but we remain open for treatment and your pharmaceutical services in any regard with where the state may go. With that, I'd like to hand it over to Ms. Baker, where she can answer a couple of your questions about our pharmacy services here at Fox.
Thank you.
Ms. Baker.
Hello, everyone. My name is Suzette Baker. I'm the Chief of Pharmacy Services here at Fox Army Health Center Pharmacy. We're getting a lot of questions on whether we're open and are we still filling prescriptions for you, and the answer is we are fully open. For refills, we do have a drive-through that is working like a well-oiled machine. Highly recommend you to continue calling in your refills. Just follow the signs when you come in. They will guide you through the lines. We may have up to 1 to 6 lines of drive-through depending on the volume. There is one change I need to tell you about. You need to call in your refills between the hours of 0600 and 1800. If you call in past 1800 hours, we ask that you please call back during the time period of 0600 and 1800. For new prescriptions, you are still welcome to come through. You will have to go through a screening tent located in front of the main health center. When you get through the screening tent, you will come into the building, but they are limiting the number of people coming in just for precaution's sakes. We ask that if you do have an electronic prescription sent in by your provider, we have opened up a separate line for you to call in for that request. That way, we can get those prescriptions ready for you ahead of time, and you can go through the drive-through and still stay in your car and pick up all your refills and all your electronic prescriptions as well. The same situation applies as always for calling in. You can call into our main line, use extension 1030, or you can use the Fox Army Health Center refill line, or you can use the TRICARE online to call in your prescriptions. Mother had asked if she could still have someone else pick up her son's medication with the patient's ID card, and the answer is yes. All the same precautions and all the same process is the same as before. You may pick up someone else's medication for them. We just need the patient's ID card as well. That's pretty much it. Yeah.
That's good. Thank you, Suzette. You'll notice too when Ms. Baker was describing precautions about screening into the pharmacy and that we can only bring in so many people. There's a number of chairs stacked up behind me, and those are from the pharmacy waiting area where we've had to ensure there's a bit of distance between chairs. So just an explanation for all the chairs behind us. They're out of the pharmacy waiting area. We continue to make those precautions where and how we can here at Fox. So with that, I want to transition over to Dr. Madkins from our PCMH. Sure.
Oh, good morning. Again, Colonel Madkins, a family medicine provider, as well as the chief of our primary care clinic here at Fox. One of the things just to keep in mind is that a lot of the recommendations that we have in terms of what we're doing with COVID-19 really come from the CDC, the Centers for Disease Control and Prevention. Again, that is fluid in terms of as more data comes in, some of those recommendations may change, but anything that's provided at this point is really just based on most of the current data that we have. Some of it is based off of studies from SARS, which again was an outbreak that occurred several years ago, which again there is a data bank of info that does lead to some of the recommendations. One of the things that I will say is in reference to one of the major questions that folks have is, what can they do in terms of limiting contracting COVID-19? Again, just reiterating some of the things that Colonel Smith mentioned earlier is really in relation to one, knowing that this condition, this virus is spread mainly through what we know as respiratory droplets, which come from coughing. So maintaining that social distancing, that 6 feet, really is going to limit your exposure to the virus from that standpoint. Also, in terms of the hand hygiene is very, very important. Making sure that you're using soap and water or hand sanitizer. Again, if you do have a cough, again, coughing into your sleeve, and again, limiting the amount of droplets that are in the air. Also, cleaning, being conscious of surfaces. Again, respiratory droplets from person to person are really the primary means of transmission. There is some thought that it may remain on surfaces for a duration of time. So just being conscious of surfaces that you're touching, and again, cleaning your hands in between those. One of the other questions that we're maintained or have received a lot is in reference to those who have actually tested positive for COVID, and what's the guidance for them in terms of return to work. Really there, again, we're going off of current CDC recommendations, which basically state that if you've been tested and have symptoms, as long as you have had a relief from your fever for at least 3 days, and that any symptoms you had, which again, the primary symptoms that have been noticed with COVID-19 are cough, fever, and shortness of breath. So again, if you've tested positive and you have those symptoms, really your return to work is based off of being fever-free without using any fever-reducing medications for at least 3 days, having a reduction in your symptoms, and having at least 7 days since the initial onset of your symptoms. We currently do not have a specific procedure for clearing folks that have been positive. Recommended that, one, if you're a beneficiary, you can speak with your PCM if non-beneficiary, really should seek guidance from your primary care manager. If you've been exposed but are still testing negative, again, that's where the quarantine comes in. Again, right now, the 14-day quarantine is based off the fact that the longest incubation period that's been noted with COVID-19 is about that 14 days. So through quarantine, it's considered that at the end of that time, as long as you have not developed any symptoms, that you have become, you are not infectious at that point.
Good afternoon, Team Redstone. It's Colonel Smith and Colonel Meador back with you again. We apologize for the technical difficulties we had yesterday, but both Colonel Meador and I decided that we wanted to get back in touch with you and try to answer the remaining questions that we weren't able to get to. And you've posed a few more, so we've got about 30 to 40 minutes here today. We're going to try and cover down on the questions that you asked. What we did get an opportunity to do was consolidate them into kind of talking points. So I ask for your patience, as our comments are probably going to be, instead of reading your question, we'll try and generalize your questions into specific questions or specific answers, and we'll try to cover multiple questions at the same time. So while I had the opportunity to say good morning or good afternoon, I'm going to turn it over to Colonel Meador and let him start with his questions.
Hey, good afternoon, Team Redstone and families. Great to be back with you again today. I have 3 I wanted to go over with you and cover with you. Great questions, by the way, so please keep them coming, even when we end today. I'd love to ensure that you get the right answers for your very important questions about Fox Army Health Center. The first question we have is, what do we do or how do we call in and get an appointment for white cards? Well, the good news is you don't need an appointment for that. Over at Fox Army Health Center, please come in. You'll notice, as I've mentioned a few times, you will screen in on the pharmacy entrance. You'll screen through, and please find your way to medical records. Medical records has an office there, which is behind the pharmacy waiting room area. And in there, you can fill out just some paperwork, and we will get your white card processed for you. Another question I had is, what will be Fox Army Health Center status if the state goes to a shelter in place? If that's the case, or if the governor does call that procedure for the state of Alabama for Fox, as we are today, we remain open for acutes. We will continue to treat acutes or take acute appointments as those are needed by you, and we will maintain pharmacy capability. If it's limited at all, it will only be in Manning, but I'll talk through that should we have to make those types of changes. But refills, new prescription pickups will still be possible. At any rate, we'll continue to push as much as we can through our drive-through line, which continues to work relatively well. I was out there again this morning speaking with some of our patients and customers in the drive-through line, as well as our staff. Appreciate you, and again, building a little more time in your schedule as you come over to Fox to come through the drive-through line. We continue to refine our Chick-fil-A method to get you through there as quickly as possible. But again, we appreciate you building a little more time in there and your patience as you come in there. No predictive analysis yet on surge times. I'd love to report to you best time of day to come. But as you know, given certain schedules and events, not sure yet what times are best. All I can say is, again, just build that time into your schedule before you come on over. The next and last question I have here for you, unless we get something else here on our question line, is about testing over at Fox Army Health Center. We have a testing capability, and as I've mentioned a few times before, our resources remain limited. We have the ability to test our Department of Defense civilians, active duty family members, and active duty. And I would convey to you that we will reach out to you to bring you in for testing. And I make that point because in some scenarios where we've had a COVID-19 positive case somewhere here on the arsenal, we've reached out to leadership and obtained names for those in close and sustained contact and brought them over to test in order to maintain control of the spread here on the arsenal. So do wait for us to reach out to you. If by chance you come into Fox Army Health Center and you screen positive, there have been some instances where, given some indications on how either you answered the questions or were exhibiting some symptoms, we did make a clinical decision to test you. So there is a possibility, by way of you screening into the building, that we need to do that. But do know the testing, although it does exist, we are limited in nature based on resources. So appreciate your consideration in that as you make your way over. Again, look forward to any other questions you may have as they present themselves, and look forward to seeing you over there at Fox Army Health Center. And again, we remain here to support you and your needs. Thank you, and back to you, sir.
All right. Hey, thank you, Colonel Meador. Okay, so you've seen Julie loading me up with questions, but first I'm going to try to get to the ones that were already posed. And first and foremost, we'll hit with a generalized question. It's a consolidation of multiple of yours, and that is, what is Redstone doing to prevent the spread of COVID-19? So before I answer that question, I'm going to answer with the public service announcement that hopefully you've seen on our websites or elsewhere. And I want to make it pretty clear that while Redstone is taking a lot of putting in place a lot of preventative and protective measures to provide for safety and security on the arsenal, the most important part of what we are doing is we are helping you to take accountability of your fight, your combating of COVID-19. First and foremost, it's good personal hygiene. Wash your hands, wash them with soap or with Purell or whatever hand sanitizer you use, but washing your hands is a 20-second chore. The next is maintain your social distancing. If you can avoid contact with others, please do so. Or a third is, if you're sick, stay at home. All of the tenant commands here, we have a liberal leave policy and a sick leave policy in place that assures that if you're sick, we request that you don't come to work. We request that you stay home and go see your PCM, so that we continue to protect those people that are here at work. And once your PCM provides you a clearance to come back to work, we welcome you back into the workforce. And last but not least is, as we see more and more measures go into place on the arsenal and off, we ask everybody to ensure that when you are driving home, that's the spot you're going to. Go home, go to the grocery store, do those essential tasks, but please limit the number of people you come into contact with on and off the arsenal, and that will help us combat COVID-19. It'll help us interfere with the transmission, and that's how we keep everyone safe. Now, on Redstone's part, the things Redstone's done up to this date is we have reduced all non-essential services. So you'll notice that our arts and crafts, our bowling alley, or bowling center, our bingo center, and all of those what we would consider luxury items have been closed. Those locations were places where people would gather socially and could easily pass the virus back and forth. Additionally, we've closed the dining rooms of all of our eateries. And in some cases, we've closed some of the eateries that no longer had demand. All of our cafeterias and all of our AFES food concessions have all moved to takeout only. And we know we've still got to provide that essential service to you. So they're still there, but we've moved to dine-in or takeout only. And that'll reduce the attempts for social gathering. Further, we've canceled any of the events that typically the observances, the ceremonies here at Redstone. You'll notice we no longer play reveille, and so forth, because we're limiting the contact of individuals in close quarters. We've done all of those things in order to help limit the opportunity for large groups to gather and to encourage organizations and people to social distance. And then what you'll see at your individual tenant commands is they have identified those mission essential people that are necessary here on the arsenal every day to execute their critical mission. And those are the primary personnel we see on the arsenal every day. We've reduced our typical population to less than a quarter of the people that typically come to Redstone any day now.
Additionally, we've installed across all the tenants, a large majority of the population is teleworking, and we've placed people on administrative leave that we no longer have a demand for, but yet we need to recall in the case that someone here catches the virus. Those are all the things that Redstone Arsenal has done in order to prepare or prevent the spread of COVID-19, but most importantly is what each and every one of us can do to help reduce the spread and keep ourselves healthy. I look forward to you protecting yourself and your family, and we will all work through this. The next question is why is non-essential construction work being asked or allowed to continue in buildings where only essential employees are working? Why is lawn care and maintenance continuing? Why is custodial continuing? That's a great question, and it's quite nuanced and probably more complex than people would like to think. The simple piece is that every tenant needs to make a decision on what critical functions they still have to provide to the Army. And in many cases, construction, preparing for our future, preparing for the growth of the organizations that are here in order to be prepared for that next weapon system or that next research project, that construction still needs to go on. Were we to cease those operations, we would not be prepared for the future that we are going to have to fulfill. In the case of lawn care and maintenance will have to continue because the sheer cost of that, if we were to let a building fall to disrepair and so forth, would be exponential and we wouldn't be able to catch up. Those things are all absolutely considered as we meet with General Perna and General Daly at least a couple times a week in order to assess the COVID-19 threat to the arsenal and as we look to continue to minimize those services. But I assure you the services that are continuing here are essential, either essential at the installation level to maintain a safe and secure work environment, or mission essential to those tenant commands who still have a national security requirement that they have to perform. The next question really comes down to, if Alabama goes into shelter in place, how will it affect the ME personnel reporting to work? From Redstone Arsenal's perspective today, and we will continue to assess, a shelter in place order should not affect mission essential personnel or mission essential functions here on the arsenal. That will be a mechanism that the state puts in place to limit travel for its community population, much like we've already done here on the arsenal. You'll notice today that traffic is down quite a bit. We've limited the places you can go. A shelter in place order in the outside community is going to do the same thing. We will still have a need for mission critical and mission essential personnel, and they will still come here to the arsenal. What your tenant commanders are doing today is they're designating you mission essential and likely giving you a set of orders. The preparations that they are doing today are in case the state of Alabama issues a shelter in place, they are giving you the reason to continue to come to work, and they are making the arrangements to ensure that your freedom of movement to get to the arsenal to perform your mission is there and in place. The next question is, why are some buildings and organizations closed and others are not? The simple answer is that the arsenal provides the safe environment and the safe installation for that workforce to come to work. But each individual tenant, and we have about 72, each tenant has a part to play in our national security. And as those tenants evaluate their mission critical requirements, they determine which individuals need to be at work and which buildings need to be operational. As the garrison, our job is to do everything we can to help that organization keep those people coming onto the arsenal and to keep those buildings and missions continuing. So while I can't answer for each individual building, I can tell you that each tenant command evaluates themselves, makes their mission essential determination, and then the installation supports their mission. The last question I have before I get to a couple that just came in, and a couple came in that are similar. And are CAC and DEER's offices open to federal contractors for walk-ins and appointments? And if there are limitations, what are they? Well, I can tell you that the CAC and ID Card Center, the one-stop, remains open and remains updating your CAC or your ID card for all of the typical beneficiaries. We continue to make new ID cards for new hires. We continue to renew ID cards for dependents and beneficiaries. Today it's a little harder, as typically we would see 200 to 250 people a day. Today, due to social distancing constraints, we're able to see anywhere between 40 to 80 people a day. What we ask is if your card is expiring in the next 30 to 60 days, that you make an appointment and you go in by appointment so that we can schedule you, we can limit the number of people that we have going in, and we can update your CAC and ID card and renew your DEERs. But we are open for business. And I'll take another question. This other question is there going to be mandatory sanitization required for facilities? And will this include buildings where contractors work, such as the Von Braun Complex or S3I? Ladies and gentlemen, I assure you that our Department of Public Works and our custodial teams are sanitizing your areas, and we sanitize them in basically 3 categories. We have what we call red, which is a standardized cleaning, an amber, which is an enhanced touch cleaning, and a green, which is a sterilization or a sterilization. Each one of those is dependent upon the type of contact that has occurred. We have reconsidered, or we've reorganized our standard cleaning, and rather than to wash windows and vacuum floors and so forth, we have reconfigured that contract so that we are touching all of the high points. We are sterilizing or sanitizing desktops, doorknobs, keypads, all of the common areas such as break rooms and bathrooms. And we're doing that multiple times a day for your safety. And that is what is going on under the surface. That's our regular custodial. The next step up is an enhanced cleaning where we bring in a sterilization team, and that sterilization team will touch all the doorknobs, all of the break areas, and all of a specific work area for an individual and a group of cubicles or a workspace who has a symptomatic patient. We do the contact trace just as Colonel Meador described. We identify those areas, and that team goes in either after hours or immediately thereafter and conducts that cleaning. And then last but not least, we have a sterilization team. If there is a positive COVID patient in any of our buildings, we're notified immediately, and we schedule a sanitization cleaning for that night or a day or two later as the workforce, because the workforce has gone home to telework. And that cleaning involves a fogging of the room. It includes a sterilization of all of the equipment within the rooms around. It's a very in-depth cleaning. And of note, all of those cleanings are conducted in accordance with the products identified by the CDC as well as OSHA. So I can assure you today that we are doing everything we can in concert with your tenant commands to protect the workforce that we do bring to work, because we know you are performing a mission critical task, and our job is to make sure that you have a safe place to do it in. I do have another question here that's, how much longer will we telework? Well, I would like to predict that. Neither Colonel Meador or I have the tools to be able to answer that for you. What I can tell you is that our mission is absolutely important, and the mission that those teleworkers are doing certainly enhances my ability as an installation commander. My teleworkers are doing all the work behind the scenes to make that happen. I appreciate what you as teleworkers are doing just as much as those of us that are still here. Everything you do supports the work we do today. And I ask that you continue to do so until that we can put this behind us and bring everyone back to work. And I noticed that Julie passed a note to Colonel Meador, so I'm going to let him answer a question while I get my notes in order.
All right, thank you. I had a great question for one of our members out there, and thank you for posting that. And I'll read it here for you. Since it takes a while to show symptoms, is there any means to start checking personnel as they enter the facility? And the answer is yes. Today, if you come over to Fox Army Health Center, we screen everyone as they come into the facility. Incidentally, we also screen all of our employees as well first thing in the day. But for customers coming into the building, we screen you at what is the pharmacy entrance to Fox Army Health Center. It's also our main entrance. And there I have a number of nurses, all trained. They're going to ask you a few questions. They're going to take your temperature and very quickly evaluate you. We have been finding for some customers that even in some cases where their temperatures were just a little bit elevated, based on how you answered the questions, we took the opportunity to bring you to the side and have a discussion, in some cases with one of our providers, to make sure that everything is okay. And this question is good too, because it allows me to go in a little bit of detail in case you do screen positive. The good news here is, for whatever reason you were coming over to Fox, whether it was to be to come inside with a new prescription or come in for an acute appointment, and if you screen positive, you're still going to get that treatment and you're still going to get the meds as you needed, or your new prescription put into the system as you needed it to be. It just means we may keep you outside the building. Right now we have a number of tents, yellow tents outside the facility from the Garrison, who are helping us out immensely in that role, that keep you there. They're air conditioned or heated depending on the temperatures, and we keep you there. And if we do need to evaluate you, we bring you into one of our buildings that are outside the main facility, where you meet with either another one of our nurses, or nurse practitioner, or a physician to ask you a few questions and dig a little bit deeper to make sure the symptoms we're seeing could be signs of something else, maybe a cold, flu, or whatnot. So the quick answer to this question is yes, we're screening everybody before they come in. We screen all of our employees in the morning before coming into the facility. And again, that's all to make sure that the facility remains as clean as possible. And we also do that to protect you and staff as well. So thank you for that question.
Thank you.
Yep.
All right, so I've got two more questions. And the question is, will Redstone start doing screenings at the gates and CDCs, or provide PPE to employees identified as KE or ME? So to answer that question, I'll start with the last point first, and that is personal protective equipment for KE and ME individuals. And based on the CDC guidelines that you're seeing out there today, I'd like to call your attention to what the designation of KE and ME is. We certainly provide the PPE, the personal protective equipment necessary by CDC and OSHA standards for those people who are firefighters, police officers, guards, healthcare professionals. That PPE is specifically designed and standardized in order to afford those personnel to operate in more austere conditions. It's difficult for each and every tenant command to identify what PPE is necessary to conduct their business, but as each tenant command identifies the PPE, those tenant commands determine what is feasible and what is necessary and issues it out. I assure you that here at Redstone, for the ME workforce that we have, predominantly your firefighters, police officers, guards, healthcare workers, we have suitable stocks on hand. We have set lines of supply, and our stores and resupply look good. In regards to providing screenings at the gates, and I know that through the national media, you're seeing that occur at many other locations. Today, as we, General Perna, General Daly, myself, Colonel Meador, as we assess the environment and we look towards where best to provide those screenings, we know that the best place to do that screening is at Fox Army Health Center. Additional screenings, while potentially viable, are resource intensive, and in addition, they have limited effectiveness. The best way to combat this is for each one of us to observe our own preventive methods, to maintain our social distancing, to ensure that we are staying at home if we feel sick, and to make sure that our actions while we're at home are consistent with keeping ourselves safe. We all rely on one another to work next to someone who feels well, who doesn't have any reason to believe they're contaminated. And that is the best protection each of us can offer each other. And that's the best protection that you can offer this installation. I ask you to help us do our part by making sure that you're doing your part. The last question I have here is, if I store my boat on Redstone Arsenal, can I still have access to the post to retrieve it and put it back? And can we still use the launch? Well, I'll answer that one backwards again. Is Redstone Arsenal's recreational activities are currently closed. So Easter Posey and the boat launch there at Easter Posey, as well as Carroll Hudson, is closed. While yes, you can go in and pull your boat out of Redstone storage, you can take your boat and you can bring your boat back. But the boat launches here at Redstone Arsenal are not going to be accessible for you. And as we see the state, if it does issue a shelter in place, I imagine that will be more difficult to maneuver the boat outside of the fences. Those are the only questions I have here today. I certainly have appreciated the opportunity to mix it up with you. I hope our answers to your questions have been informative. And I'll turn it over to Colonel Meador before I close it up.
Yeah, thank you. I wanted to add a couple of admin notes that were covered yesterday, but just to reemphasize them from Ms. Baker, my pharmacy department chief. With your pharmaceuticals, for your refills, as you know, you can call those in during the day. Please do those during daily hours from 8 a.m. to 6 p.m. At night, the system with which to receive your phone call or your call-in for refills is currently not operating. So please do call in those refills during the day. And as a reminder, for your new prescriptions, you can walk in with those to get those initially filled. And again, would ask that for any follow-on refills, you do those through our drive-through via call-ins and whatnot. Appreciate your patronage at Fox Army Health Center. As always, look forward to seeing you there. Sir.
All right. Hey, and I'll close it up in this way is, again, each and every one of us has to do our part in order to protect the livelihoods and benefits of all of us. So thank you very much for the part that you play. Thank you for helping us to keep Redstone safe, to keep it secure, and keep our nationally critical missions going. I'd like to tell you that while I appreciate the opportunity to talk with you and to answer your questions, I need you to, I know that the best place for you to get your information and to have your questions answered is at your chain of command. Within your tenant organizations, they can best advise you of how they are running your organization and what they are doing, as well as the installation is doing, to ensure that you can continue to do your mission safely. However, if we are always here for you, please contact us on Facebook at Team Redstone. You're watching us here today. Read our website, check the CDC websites, and of course, you're free to email or send in the ICE, and we'll get back to you as soon as we can. On behalf of General Perna, on behalf of Lieutenant General Daly, myself, and Colonel Meador, thank you for the time that you've given us to engage with you, and thank you very much for keeping Team Redstone great. Have a great day.